most healthcare leaders have probably tried to mimic their counterparts in the technology industry more than was warranted. So it's another way of saying it is a lot easier to be the CEO of a major technology company than the CEO of a hospital or a CEO of a health plan, because running a hospital and a health plan is actually a lot harder than running a company that makes, Fitbits or makes widgets that I wear on my wrist. It's another way of saying I think leaders in healthcare have to be a lot more humble about the tremendous complexity of what they're doing. The solutions will be harder to come by. It's highly unlikely that what fixes healthcare is a single technology or a single app, but that's often the confidence with which they speak, and that worries me a lot. I think leaders have also got to be far more sophisticated in understanding evidence. So it's very common for me to meet a leader who says, we've done this and it saved that. So they'll say, we came up with the program to target high-cost patients, and that reduced medical spending by 12%. So that's a typical statement. You hear that all the time. It turns out that if you scratch under the surface, what really this hospital did was they found that spending on high-cost patients had fallen 12% before and after their program went into effect. But what they forgot was that spending on high-cost patients falls even if you do nothing to high-cost patients. So patients are high-cost one day, and then they're low-cost the next day, right? And so, again, you often hear people thinking that the program that they implemented generated a lot more value, saved a lot more money, or improved outcomes a lot more than it actually did, just because they're not particularly sophisticated in thinking about evidence. I don't think you need the hospital CEO to be trained on this, but you need a staff and a team around him or her helping this person make sense of what works and what doesn't in their system. I think healthcare leaders tend to be incredibly aspirational often about what is working in their system relative to the actual evidence for it.